This is Chapter 12, Part 3. We want to calculate the daily fluid maintenance amount for a child who weighs 35 kilograms. And then at what rate should the pump be set in milliliters per hour? Okay, so what we do is, because we determine how much fluid the child needs based on body weight. The first 10 kilograms of the body weight is 100 each. So what we're going to need to do is we're going to need to break 35 up. So if for the first 10, we have to worry about. And then we have the second 10, which brings us up to a total of 20 kilograms. Now, how many kilograms do I have left if I've used 20? 35 minus 20 is 15, so I need another 15. Okay, the first 10, you're going to need 100 each. The second 10, we're going to need 50 each. And for the last 15, we're going to need 20 each. Now what they do here is they show you that they broke it up just like I did. The first 10, the second 10, the last 15. For the first 10, we need 100 milliliters each. Here we need 50 milliliters each. And here we need 20 milliliters each. So the total amount of fluid the child needs is going to be 100 times 10 plus 50 times 10 plus 20 times 15. 100 for each of the first 10, 50 for each of the second 10, 20 for everything above that. So when you do this multiplication, you get 100 plus 500, 1,000, sorry, plus 500 plus 300, which is a total of 1,800 milliliters per day. Okay, so we found out how much fluid the child needs over the course of an entire day. We are asked to set what rate should the pump be set in milliliters per hour. And this is right now milliliters per day. So let's convert this to milliliters per hour. We have 1,800 milliliters for one day. And in one day, there is 24 hours. Days cancel. 1,800 divided by 24, because when you multiply, that's what you're going to get, is 75 milliliters per hour. And that would be the answer you're looking for. Okay, so here they did it in a chart, and they did the multiplication just like we did, 1,000, 500, 300, with a total of 1,800. And then they did the conversion just like we did. We converted one day into 24 hours to get 75 milliliters per hour. Okay, this is a short chapter. We have talked about how shortcuts can be fatal. We have to check for the safe dose. If you're in doubt, always check. Okay, always check, sometimes round it down. This we learned earlier in an earlier chapter. IV bags of no more than 500 milliliters should be hung for pediatric patients. And no more than 2 milliliters should be given intramuscularly to a pediatric patient. We talked about that too in an earlier chapter. Okay, you should, accuracy is crucial, so you're always going to use electronic control devices when we talked about setting the pump. Okay. You need to know the facility's policy regarding inclusion of medication volume as part of the total infusion volume. Know your facility's policies. Okay, and we always err on giving too little rather than too much. And daily fluid maintenance depends on the weight of the child. We've already talked about that. So this is the end of the course.